Good morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
Well, good morning. Welcome back to Insurance Matchmaking. Yes, as I've been mentioning the last couple of weeks, we're in the height of the dual enrollment time. My calendar is getting very full. And I think I mentioned last week on the radio, I do have Saturday appointments available. And on top of that, I do not participate in Black Friday. I work that day. I work that Saturday also. We take the time to get together as a family on Thanksgiving, of course. And it is such a busy time this time of year that just really can't afford to go 4 days without working. I guess I could, but it just made more work the next week. So I try to get caught up. This last Saturday, didn't end up with any appointments last Saturday, but I did get a lot of things done. Was able to get some quotes out to review some of the stuff people had sent me, and also I went to I had to get my VFW paperwork done. We had our monthly meeting last night, so I had all that stuff ready for the meeting. It's kind of hard to keep up with all that since I am what they call a quartermaster, which is the secretary-treasurer, so I have to get reports ready for that. But so yeah, like I said, very busy time, but yes, that Friday after Thanksgiving, if you don't want to deal with, crazy shoppers, that's a great time to take care of your insurance. So, book appointment with me on that Friday. And also basically every Saturday between now and December 7th is going to be a work day. I do have somebody actually scheduled an appointment on December 6th, so I've got one appointment that day already. And then possibly the following Saturday, I haven't made up my mind yet on that one because that is the deadline for the Affordable Care Act. Probably what will happen is if I have somebody schedule an appointment, I will work, but I probably won't work that Saturday if I don't have anybody scheduled on an appointment, and then I'll kind of get into the Christmas mode. I don't do Christmas. I don't do Christmas. I don't do Christmas in November, for one thing. I very much look forward to Thanksgiving, which that is this coming week after this coming Thursday, believe it or not, folks, is Thanksgiving. And, get together with your families. In November, I want to think about Thanksgiving. After Thanksgiving, then now it's time to get ready for Christmas. We've got a whole month to still get ready for Christmas after Thanksgiving. We don't need to start it in October or on November 1st. That's just my rant. Sorry about that. But yeah, I do kind of start taking a break around Christmas because we're just not enrolling in. And, of course, sometimes the marketplace will come back and say, oh, because of this or because of that, the 15th deadline, we're going to extend that to the 16th, the 18th, whatever. And I kind of half expect that this year with the government shutdown and the non-continuation of the enhanced subsidies. People are finding out that, wow, my silver plan's really going up this year. And so there's going to be a lot more people. And what'll determine it is if they start getting a lot of complaints, people trying to call the healthcare marketplace and can't get through because of everybody calling in. That's when they'll extend the deadline, and they may or may not do it. Different administration, who knows? They may say it's 15th is the 15th, and they're not going to pay overtime and all that. So we'll see. But I did some ciphering, as they say. A lot of the stuff you've been hearing on the news about how millions of people are going to lose their insurance because the tax credits didn't get extended. Now, and I've had to calm a lot of people down because they thought the subsidies were totally going away. And of course, and then that's politics. No, they're not going away. They're going back to what they were before they were enhanced. And the deadline was set for that. And I love how people, they want to blame the Republicans, blame Trump's one big, beautiful bill. And actually, that's both misplaced. The cost, yes, people aren't getting enhanced. And as I've spoke on this, and I've always talked about this even before the government shutdown, was yes, I would like to see the portion of the extension was those that were over 400% could still qualify for a tax credit, because what I've seen happen to too many people, or they decided not to go in the marketplace because they estimated their income was going to be right at that cap or maybe a little bit over, and knew if they took the subsidy, they'd owe that all back when they did their taxes. Those are the ones that really hurts, because if you're at 399% of the subsidy level, you have a great subsidy still. You can, it actually is somewhat affordable. When you go to 401%, because I'm not sure where it cuts off. If it actually cuts off at 400 or if it's over 400. So that's why I'm saying at $399, you've got a great tax credit, pretty good tax credit. At 401, you aren't entitled to any. Now, this year and the last couple of years, when we did have the enhanced credits, we had people that were like 500% of the poverty level still had a tax credit. Now, it was very small, but it was there. And the reason I like that slope off it, and there's a YouTuber that uses the same phrase I have and call it the 400% tax credit cliff, because the tax credit's still pretty substantial at 400%, but when you go over it, you fall off that cliff where there's no subsidy. Whereas with the enhanced tax credit, it's sloped down. So you start at, if you have zero tax credit up to 100%, and then at 100%, you start a really high tax credit, and then it tapers down as your income goes up until you're no longer eligible for it. And the way they did that with calculations they made, they use the second lowest silver plan as the benchmark. I know I've said this several times, but I'm going to repeat it here because it's going to lead into my illustration I'm going to do here in a moment. The tax credit would slope down until you hit that mark, that 8.8% of your income would be spent for the second spent. And I don't think it's the exact cost, but it would cover, your income would cover 70% of that second lowest silver plan. I think that's kind of the way it worked. The tax credit would get you to where you're only paying 70%. I don't know the formula exactly, but I do know that I'm correct on the second lowest silver plan. That's what affects the subsidy. And like I said, and I've said here now for several weeks, the enhanced tax credits are going to have a lot more effect on the people who are at that upper level and aren't qualifying. I've got a couple I helped with that recently. I should have written down the number on theirs, but I think they were looking at like $1,800 for the bronze plan. Maybe it was $1,200. Anyway, it was over $1,000. I've got them a plan that, you've heard me talk about Medicare, and they went for the highest annual share plan on that, following my recommendation. So that put that plan at about $500. And that's for a couple, 50s and late 50s, early 60s in age group. And then we have a plan called Wellness Share, and that plan works to go alongside a plan like Medicare where you have a lot of out-of-pocket costs before your costs are shared. And the same thing would work also with the short-term plans that I've talked about that have a high deductible that don't cover your preventive. Now, this plan here, the lowest level is just preventive, but it will cover those preventive things that that need to be done on an annual basis. Ladies' wellness check, prostate check. If it's time for your colonoscopy, it covers that. And very inexpensive on that one. You don't need it if you have a marketplace plan because your preventive things are covered. So that's not the right. I don't recommend this plan for people who have what we call a qualified health plan, whether that's a marketplace plan or a plan through your employer. Those are qualified health plans, and they have to cover the preventive care. So you're good there. But and it was like $220. So they're paying a little over $700 for a complete coverage package. So quite a bit less than if they stayed with what they had on the marketplace. So the other example I have, as I said, I wanted to lead into, is I worked with a repeat client yesterday. He's very much on that lowest, that lower part of the income level. So he gets the max cost sharing reduction on a silver plan. So we looked at a couple of options. I did look at the bronze just to see if, that maybe was an idea for him, in which, of course, it would be a zero premium, but then he would have a $7,500 deductible and a $10,000 max out of pocket. So the max out of pocket exposure was very high on that, and we determined after discussing back and forth that it still made sense to get the silver plan, even though the silver plan for his net cost went up $105. So that's actually not that bad. I mean, he was paying $91 and it went to $196. So like I said, it's about $100 more, but he's still he's paying less than $200 a month for his health insurance. but he has a zero deductible and a $2,200 max out of pocket. And he has some health conditions. I'm thinking possibly he may hit that max out of pocket again with the under 65 health insurance. Your prescription costs are combined. It's a health and prescription, or medical care and prescription are combined into that max out of pocket. Works a little differently with Medicare, and we may go into that a little bit after the break. So anyway, here's the difference in his plan. So right now, his plan that he's paying $91.75 for is the cost of that plan is $718. And so he has a $627 tax credit that helps bring that $718 down to $91. So for next year, the plan is going to be $1,100. It actually went the plan premium, not what part he's paying. The premium itself on the plan went up $385. That's actually a 35% increase in the premium. Now, let me tell you, the One Big Beautiful Bill, the enhanced tax credits had no direct influence on that price increase. The price increase is the price increase. Pretty much all the carriers did it. Now, did they raise it because they were anticipating the credits being extended? That is a possibility. But that's what they raised the rates. If you want to blame somebody for health care going up, try not to be too political here, but I would put the blame on the guy that said he was going to make it affordable. I'll just leave that there. So anyway, and then his premium tax credit went from $627 to $907. So again, that was $280. So close to the $300 increase was still, a lot of it was taken care of by his premium tax credit. The tax credit went up 31% from what he was receiving. So there was about 4% of the cost that wasn't absorbed by the tax credit, and that's kind of why he had a $100 increase, net increase in what he's paying for his health insurance. So again, none of that had to do with the enhanced tax credit. Maybe the enhanced tax credits might have been a little bit more if they had stayed on there. But if you just went back to the way it was, 2-3 years ago, the increase is more laid on the shoulders of the increase in premium. So we're up on the break here, and I'll be right back after the commercials.
Join Habitat Restore at their pop-up donation event every second Saturday of each month at First National Bank in Sparta. The Habitat team will be there ready to go to receive your donations. So don't miss an opportunity to declutter and make a difference at First National Bank in Sparta with the Habitat Restore pop-up donation event every second Saturday of the month.
Hi, this is James Green, your local Twin Lakes security sales consultant. During the busy holiday season, it's easy to get caught up in shopping, traveling, but don't forget about what matters most, keeping your home safe. With Twin Lakes Security, you can enjoy peace of mind knowing your system is always working in the background. Control your lights, arm your system, and even greet guests right from your phone. Call 931-528-2005 or visit us at twinlakes.net to learn more.
Twin Lakes Security, TN-CERT C-0026.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, and we're back on Insurance Matchmaking. Before the break, I was just using an example of a client whose insurance went up about $300. The actual premium went up about $300, but his net cost went up about $100. So, and I don't know if I said this last week on the radio, but one of the things I've been mentioning to folks is that a lot of people say, if we don't extend the expanded tax credits, millions of people are going to lose their insurance. Guess what, folks? Nobody's losing their insurance. They may be choosing not to continue their insurance, but no one is taking it away from them. But you have people who were qualifying for a subsidy or were qualifying for more subsidy, and they're determining that it's not cost effective or it's not worth the cost for them. They'd rather take the risk and not have insurance. But the government is not taking anybody's insurance away. They're not saying that everybody has access to the insurance. Unfortunately, in our state, it's one of those states that didn't expand Medicaid. So we do have a lot of folks that aren't aren't getting coverage based on, their income is below that 100% of the poverty level, so they're not eligible for the tax credits in the healthcare marketplace. They're still eligible to enroll in a plan. Just like someone who's over 65, they aren't banned from getting a healthcare marketplace plan, but now that they're eligible for Medicare, they're no longer eligible for the tax credits. So I've had to have that discussion with people that were, like my client here who's only paying $200, less than $200 for his health insurance with a very low max out of pocket and everything based on his income. But if he was on Medicare, he would have to pay that $203 Part B premium that's coming up next year. So he'd actually be paying more for his insurance, and that's just for the government part of Medicare. He wouldn't have a Medicare supplement or a Medicare Advantage unless he chose one at that time. And then have to have copays on prescriptions, and we used to worry about that infamous donut hole. Now it's just a matter of, whether is the insurance company going to cover that drug or not, because it's so expensive, because the insurance companies have the burden of about 60% of the drug costs, which was being shared other ways. And when people would hit what's called the catastrophic level, the insurance companies were having to shoulder about 20% of the cost. Now it's 60%. So when you triple how much the insurance companies are going to pay for those high-cost prescription drugs, they're going to make adjustments elsewhere. One of those adjustments is not paying us commission on plans anymore. And I don't know and I may have mentioned this last week. They've taken some of the plans off of the online enrollment platforms. They say, yes, you can send in a paper app. I haven't done paper apps in half a dozen years. And once we finally could do electronic apps with everybody, that's what I did. It was so much better than doing paper. When I started, we had to do, and the thing is with the paper app, and then you have a deadline. You got to get that submitted within 24 or 48 hours, depending on the carrier, and you have to fax it in. There are a few carriers that do let you scan it and then upload it, but most of the time it would be a fax. I don't even own a fax machine anymore. I mean, I can still fax. I can scan on my scanner and send it through an online program, but that's so archaic. But we can't even do the comparisons in the way we used to. So that's adding some time to it. And yes, I'm going to help people. I'm going to help figure out what drug plan works for them. But unfortunately, I used to get paid a little bit for it. Now I'm not getting paid for that drug plan. So it's a little frustrating on that part. But it is getting a little harder to do that. I mentioned also, if you have a Part D drug plan because you have a plan G, F, or N Medicare supplement plan, and you have a prescription drug plan, you really need to look at that prescription drug plan this year. You maybe weren't paying much last year. Most of the plans that weren't very expensive last year are expensive this year. One plan that was $27 is now $77. Another plan that was I'm trying to think, the one was like $94. It's now I think $119. So yeah, there's some increases on some of the drug plans. One carrier, I signed a lot of people up on a plan a few years back. It was, depending on what year it was $650 or $750 for the plan. That was the bargain plan at the time, and now the plan is like $80-some. That company only is offering one plan. So got people, needing help on that. And the thing is, I had one customer that just worked with last week, helped her get. She had that plan, and it was going to be like $88 a month. I mean, I haven't even kept track of that premium because I haven't offered that carrier in like the last 2 years. So it's like I haven't even really focused on what their premium is. But I knew her premium was going to be high. Anyway, I was able to put her on a zero premium plan with one of the carriers. But that plan has a $615 deductible, and that deductible applies to all tiers of the drugs. When I talk about the tiers, tier 1 and 2 are your generics, tier 3 is usually your brand names, 4 is non-preferred, and 5 is specialty drugs. Now, you can have a brand name drug on tier 2, and you can have a generic drug on tier 4. So those are generalizations of what those tier levels are. But a lot of plans will exclude tier 1 and 2 from the deductible, and so you'll just have the copay where the copay may be $1, $2, from $0 to $5, copay on tier 1 and 2. This plan is not set up that way. Everything goes towards the deductible. She had 3 very low-cost generic drugs, and the estimate was she was going to pay $735 a month for her 3 prescriptions because she's paying full price. She did not need an expensive drug plan. Now, the thing is with the government, if you are eligible for Part D and don't have Part D and you sign up for Part D later, you are subject to a late enrollment penalty, and that late enrollment penalty will stay with you as long as you have a Part D plan, whether that Part D is a standalone PDP, as we call them, prescription drug plan, or that Part D is part of your Medicare Advantage MAPD plan. The Part D applies, and it applies the same on a Medicare Advantage as it does the Part D drug plan. The deductibles, when you hit your max, that's all the same format. One of the things I've been encouraging a lot of folks, I've got a plan I need to look at, or not a plan, but I need to look over a friend's plan and figure out which plan's going to work for him. And I'm probably going to recommend that he go on the prescription payment plan just because he has so many prescriptions. What's great about that plan is, again, I've mentioned the deductible. Almost every drug plan out there has a deductible, and probably, if not 90% of the Medicare Advantage plans have instituted some sort of deductible for the Part D prescription drugs. Now, on the Advantage plans, a lot of them are around $200, $250, but some of them still are at $615. That's the max deductible they can put on Part D. And most of your drug plans have that. Like I said, some of them will exclude Tier 1 and 2. And there's 1 or 2 very expensive drug plans that if you're paying that, you don't have the deductible. But most of them are going to still have a small deductible. Even there's one that this year was a very expensive plan, had no deductible. This next year it has, I believe, the deductible is $130. So pretty much everybody's going to experience a deductible. But this was just crazy, though. Like I said, I helped this lady, got her a 0 premium plan, and she will now have she just has to pay for her prescriptions out of her pocket. But she will have a low, she's not going to have a copay. She's just going to buy her drugs direct from the pharmacy. But it's like $7 and something a month. It was going to be like $88 for the year, which was like 1 month's premium on the plan she was looking at, So I was able to save her quite a bit of money on her drug costs. Now, yes, she could run into issue if she got prescribed something that's a Tier 3. I mean, she basically, she'd have to come up with the rest of the deductible from what she's paid on her regular prescriptions. And again, you have that $2,100 maximum. I was looking at somebody yesterday that if she gets a 90-day supply of all her prescriptions in January, she'll basically pay the deductible in the cost, and then she's done for the year paying for her drugs. If she does it, it was weird, kind of a weird number, because again, the computations of, they say the max is $2,100, but even then, some people don't even spend that much. And in her case, I think it was, if she got all her prescriptions in a month's supply, it would be $181 and change for January, February, March, and in April she's met her max out of pocket and her prescriptions are covered for the rest of the year. So some of the way they compute those maxes, and I think that's one of the things I think they made a mistake on, is if you say the max, because that was the thing, it was always confusing before we had what they called it TROOP, and it stood for true out-of-pocket costs. But the problem was the true out-of-pocket costs were always an approximate number. So I don't know how you call them true if you have to approximate. But when they went with the $2,000 maximum for this year, going up to $2,100 next year from the Inflation Reduction Act, there's still credits that are applied, that there's a standard cost for a drug, and it may be, and because it's Tier 3, you should be paying 25% of the cost, but because that plan has it as a copay, you get credit for paying, the $100 and some dollars, that's the 25% instead of paying $47 as a copay. $47 as a copay counts just like you paid $100 for the 25%. To me, I think that's wrong. If you say there's going to be a $2,000 or $2,100 maximum on prescriptions, that's what everybody should be paying. And then when they hit the max, they've hit their max. Now, of course, I know some of the people that really helps them that they're not having to pay the full $2,000. But again, like I said, that's where the insurance companies have to absorb more of the cost, so they're cutting benefits elsewhere, especially on the Medicare Advantage plans. And most of the Medicare Advantage companies also offer Part D prescription drugs, and so they're absorbing a lot of those costs. So they're cutting back on dental plans. They're cutting back on over-the-counter. One of the things I haven't seen, it didn't seem to hit what we call the give-back plans. Those are pretty much still there. And then we also have a lot of people asking about the food cards. Most of the food cards are going to be on some type of special needs plan. They're going to be for low income, and especially those that have the chronic, we call C-SNPs, chronic special needs plans, for those that have diabetes, some plans kidney disease, and then other, COPD or heart disease. Those are kind of the ones that will fall under that. There's other issues somebody may have that doesn't necessarily qualify them for the chronic special needs plan. But those are the ones that generally will have a food card. You have to qualify for a special needs plan. And the beauty on those plans are, if you do qualify for them, or you find out you qualify for that plan mid-year, you do get a special enrollment to go on a chronic special needs plan. It's a continuous special enrollment, but you can only use it once. Once you're on a special needs plan, you can't use it to pick a different one. Then you would, if you want to change it to a different one, you have to wait for another valid enrollment period. And I've mentioned it here because I can't advertise it after the first of the year, but the first 3 months of the year, if you have a Medicare Advantage plan, you can change your Medicare Advantage plan. You can go back to original Medicare, pick up a drug plan, and get a Medicare supplement if that applies to, if that's what your goal is, or just pick up a drug plan. Whatever you're trying to do, you can change your plan January, February, March, up to March 31st. It will take effect the first of the month from whatever month after you enroll, but you can't use that enrollment period again. So we're in the annual enrollment period. That's what I always say. If you're out of it took a long time to get here. I just realized I started this was, if you have that Part D drug plan, you definitely need to look at that now. If you have a Medicare Advantage and everything seems to be okay, it's not a big rush. You have that 3 months after the first of the year that you could still change your Medicare Advantage plan. The other thing with Medicare Advantage plans are some of them are going away. They're doing what they call service area reductions. So it's like, there may be a United Healthcare or Humana plan in your county, but the one you have is going away. So sometimes you have to change plans. Now, the good news there is if you miss that and don't take care of that by December 7th, you still have a special enrollment period the first couple months of the year because you lost your coverage. You still fall into that 63-day special enrollment that you lost coverage, and it wasn't because you didn't pay your bill. It doesn't apply here with the Medicare Advantage plan. If the plan went away, you could get a special enrollment. So looks like I'm up against the clock here. Again, stay tuned to Grace 107.7. Listen to Insurance Matchmaking. Please go to insurancematchmaking.com. Check out my past shows and subscribe to my YouTube channel. Helps me get the word out about folks. But until next week, we'll talk to you on Insurance Matchmaking. Take care.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.